The practice of medicine is hard enough as it is. You see the patient, you provide the service, and you document the encounter. You submit the claim typically to a third-party payer, in this case, an insurance company, and you should be paid at the level of complexity for which you submit the claim. Unfortunately, that is being upended frequently by insurance companies by, number one, not paying the claim, or number two, downcoding your claim. For instance, this could be a 99214 at level 4 established patient visit, but they automatically downcode you to a 99213. The result is they end up paying you less money. That is one of the many games that are being played by the insurance companies, and I call it a scam. A scam is a dishonest scheme or a fraud, and that is happening, and I hear it from my colleagues across the country. They share with me that, guess what? This payer is automatically downcoding my claims. For instance, Aetna or Blue Cross Anthem or United Healthcare or Cigna. Well, I'm here to tell you that this is common practice, and it is nothing new, believe it or not. And I'm going to share with you some of the things that have been happening for, I think now, 20 some odd years ago. So let me share with you. This is something from the Journal of American Dental Association. And the title here says, "The Aetna Settlement could be a model for the industry." The American Dental Association filed this lawsuit against Aetna on August 15th of 2001. That's over 20 years ago. The ADA's complaint alleged that between 1995 and 2003, Aetna improperly denied, delayed, and or reduced payments to dentists by engaging in several types of allegedly improper conduct, including bundling, downcoding, and rejecting claims for covered services. Haven't we heard that before? The complaint also alleged that Aetna used improper guidelines and criteria to determine usual, customary, and reasonable, or UCR, fees for out-of-network dentists. The complaint claimed that this conduct violated federal and state laws. You think that's something? There is more. Let's go over to the next page. Aetna Settlement Overview Agreement dated May 21st, 2003, 19 years ago. Final approval by Judge Moreno, August 24, 2003. This is from Texas Medical Association's website. And this is an overview of the major provisions of the Aetna settlement likely to be of interest to physicians. And I'm just going to scroll down here. Prospective relief of $300 million. And if you go down here, reduced downcoding. Evaluation and management codes will not be automatically downcoded. Section 7.19. Yeah, this is nothing new. This has been going on forever. And let's go over to the next one. This is from American Medical News, amednews.com. And I'm going to put the links in the video description. This is an opinion piece dated January 3rd of 2005, 17 years ago. The RICO, Racketeer Influence Corrupt Organizations Act, physician class action suit against the managed care industry identified automatic downcoding as one of the industry's major rackets. Aetna and Cigna have settled with physicians. The settlements prohibit automatic downcoding, and the RICO attorneys are holding them to their word. Doesn't look like, or doesn't sound like they've learned anything in the last 20 years. This is still happening. The automatic downcoding is still happening. You submit a claim for a certain level, and certain payers are automatically paying you less because they feel like it. And what happens is they're supposed to pay you a certain amount when you submit the claim, but when they deny the payment or they downcode the claim, what happens is they get to hold on to that revenue that they're not paying you. So this float is money that they have control over. They can invest it. They can use it for other purposes to increase profits. But the bottom line is they're not paying the physicians properly. The other thing is, and this is common, everybody, any billing company is going to be able to tell you that this happens. A lot of the small practices or even large practices, the coding and billing team when they receive this downcoding, they're automatically saying, okay, this is the appropriate adjudication. I'm not going to fight it. And they write off the difference and they say, okay, this claim has been paid in their practice management software. So the physicians producing this type of work, they're getting paid this amount and nobody's checking the difference. Nobody's fighting for the difference because often the amounts are fairly small and sometimes the coding and billing staff, the posting staff may not think that is important to fight over the difference. Well, I think for you, all of you who are listening, who are practicing physicians, you should definitely, number one, be talking to a billing staff. And number two, when there are these improper automatic downcodes, you need to be fighting every single one of those claims. And here's the thing. Those of you who provide medical services, I know you are doing them because there is medical necessity, which is the number one thing that you need to code an evaluation and management service or a CPT service. When you provide the medically necessary service and you provide a service and you understand the rules of the game, these are coding rules, evaluation and management rules that have been recently updated in 2021. If you understand these rules and you're applying them properly, and despite that, payers are scamming you. I hate to say it. I'm just going to say it the way it is. They're scamming you. They're downcoding your claims. It is up to you to fight every one of those claims because you provided the service, you appropriately coded the level of service, and now they're underpaying you. For what reason, right? Some of the reasons was, well, they're using some sort of a national standard and you are coding above some sort of a national coding metric. Well, I hate to say it, most physicians are not very good coders. They don't quite understand the rules of the game. So they often try to undercode, or they simply are ignorant of the appropriate coding rules. So they are undercoding. And those of us who understand the rules of the game, who are appropriately coding, are being flagged for being the outliers, for being coding more than your peers in your area for coding a certain evaluation and management level. It's unfortunate, but one of my goals in everything that I do is to educate physicians so they understand these coding and billing rules so they can be more appropriately coding and not undercoding. And for those of you who think undercoding is going to keep me off the radar so I am not as likely to be audited, nothing could be further from the truth. And I will tell you again, if you are deliberately undercoding, you are not going to avoid an audit. You are not going to avoid an audit. Audits are happening no matter what. And it is more important for you to understand these coding rules and appropriately code. Appropriately code. If you think that you're providing a level 4 service, code it appropriately at level 4. This is the ethical thing to do. This is the right thing to do. And you've provided the level of service. You deserve to be paid at the commensurate level. And you should not be automatically downcoded by the insurance company, and you should definitely not try to deliberately downcode. You can ask any revenue cycle management company, ask any coding company, any billing company, they will tell you that deliberate undercoding is not going to avoid an audit. And I say this again, deliberate undercoding is not going to avoid an audit for you. So you may as well code appropriately at the level that you deserve and fight every single claim that is automatically downcoded by these scammers. I hate to say it, scammers. These insurance companies are thinking that when they downcode, say, 1 million claims, only a fraction of these claims are going to come back. Only a fraction of these claims will the payer or the providers, the physicians, the qualified health professionals, only a small fraction of these claims will be fought back by the providers or the qualified health professionals. So the difference between those who are filing an appeal versus those who didn't, well, that's more float to them. That is more margin to them. And I think when they continue to do this, there will be another class action lawsuit. There will be another lawsuit filed on behalf of physicians. And there are plenty of attorneys out there who would love to nail these insurance companies under the RICO statute so that they will learn again. It's been 20 years ago, $300 million plus settlement. They haven't learned. They're still doing the same thing. So it is up to physicians to be educated on correct coding and so that you understand what you should be doing, and then you should submit the claims appropriately, bill at the correct level, and you should insist on getting the claims and the payment that you deserve. You should not be subject to automatic downcoding and getting screwed by these payers for doing the automatic downcoding, which is essentially a scam, a scheme to defraud you, to a dishonest scheme. It's a fraud. So if you are watching and you have been subject to these automatic downcodes, I would love to hear from you and see what is going on currently with your payers. And this is happening every single day. And it's not just limited to small practices, but also large practices, primary care, specialty. It doesn't matter. You can read the reports. You can go on forums. You can go on Facebook groups. This is happening all over the country every single day. It is unfortunate, but it is a game. It is a game that we have to play. There are rules, and sometimes there are people who try to scam you, to skirt the rules and not follow the rules. And in this case, I think the payers are doing that right now. The insurance companies are doing that. It is up to the physicians, the practices, the coders and billers to be diligent with your coding and billing, with the adjudications, with the automatic postings, to make sure that you are not getting screwed by these payers. As usual, any comments or questions, please leave them below, and I will leave the links to the websites in the comments. Thank you so much again for the privilege of your time. Please take care of yourself and take care of each other. Bye-bye.